In the heart of our community, a new life begins. It's a journey of hope, of dreams, and of immense strength. But for too many mothers, this journey is shadowed by risk, uncertainty, and preventable dangers. CLIPASA and SAMAHE, standing together with the mothers at the Ndejje Health Center IV in Kampala, Uganda.
CLIPASA and SAMAHE visited Ndejje Health Center IV in Uganda. We had two groups. We had postnatal mothers and antenatal mothers. Postnatal mothers these are mothers who come for follow-up after giving birth. Sometimes they come for vaccination. It's a package. So when they come, it's not only to come for vaccination, but let me say she got a tear, then it was repaired. A midwife would like to know, is she healed? Does she need more attention? That's when we assess them. So they still require attention even during the postnatal period. So we had this group of postnatal mothers, and they were sensitized about vaccination, family planning, and then we needed to hear if they know much about family planning and what do they say, and posed some questions about fistula and anything that can complicate the 9 months or after the 9 months, because at the end of the day we look at the mother and the baby being okay. So that was the first group that we looked at. We had our second group of pregnant women. These are mothers who came for antenatal services. It was nice to interact with them and then see prime gravidas. Prime gravida is a mother who is having her first child. And then we looked at the elderly prime gravidas. These are mothers who are pregnant, but they are above 35 years of age. Anyone above 35 years of age is called an elderly prime gravida. So it was nice to interact with them and see how they are maneuvering through the 9 months of pregnancy. I sensitized these mothers about the importance of having proper antenatal assessment. Here we look at the 8 visits that the World Health Organization recommends for these pregnant women during the 9 months. Though we may tend to give them more visits depending on the condition of the mother. Let me say she has a breech presentation, a big baby, a previous scar, already any pregnancy, HIV/AIDS, anything that can complicate the 9 months, because we look at the well-being after the 9 months. We deal with it during antenatal assessment. That's why it is crucial for them to take antenatal services very serious. There is a mother who asked me, what is a breech presentation? That they told her she has a breech presentation, so she needed to go for a cesarean section. So all these factors that hinder them from having a proper, delivery or normal delivery are dealt with during antenatal services. That's what we were looking at with these women. How many babies have they had? Do they plan to have more after that? Have they done scans? What did the doctors say? Do midwives follow them? Do they have other complications like anemia, tuberculosis, malaria, and pregnancy? All those complications that can bring trouble, we look at these repercussions as something we can prevent during antenatal. So mothers have to know that antenatal is not only a preventive measure, but something crucial during the 9 months. If antenatal assessment is done well, women are able to live and have healthy babies, because midwives are able to rule out anything that can complicate the 9 months. So we had to discuss that with women. And lastly, we gave them a meal. That was something we carried for them. And some gifts like soap to wash their clothes and sugar and anything that we presented to them. Thanks to our donors who provide, they give me some funding for that. And I'm thankful for that. So that was the trip we had in a Ndejje Health Center IV. The midwives were cooperative. My gosh, I looked at these midwives as a tool that we can use to end maternal mortality. Midwives, I met a group during postnatal assessment. I had midwives during the antenatal. They were different. And then I had on the ward, I engaged with them. I asked them because I need to know what hinders them from giving proper assessment to these women. And then they are willing really to give good services. For me, having written a book about the role of midwives to end maternal mortality, I looked at these midwives as a tool to help me preach the gospel of ending maternal mortality. I always believe that doctors, midwives, nurses, and any other health workers involved can come to consensus and look for a solution to maternal mortality. Let's end maternal mortality. Thank you for always supporting us and encouraging us, and it's a big service to help these women have health babies or have health pregnancies or go through the 9 months without complications. Thank you. Together we can end maternal mortality.
Our mission is clear: to walk alongside every antenatal and postnatal mother. We are here to empower, to educate, and to equip. This is our collective stand. This is our fight to end maternal mortality. How you can help: donate to fund maternal health programs. Volunteer your skills in healthcare, counseling, or advocacy. Spread awareness by sharing this story and breaking the silence on maternal mortality. Join us today. Visit www.clipasa.org.